We still have a few people rolling in, but that is a-okay. So welcome everybody. This is the BRC crash course, the Neuro Intro crash course with BRC. It stands for Brain Resource Creation. And at SN, we're a department that whose goal is to create educational content to help middle, high school, and college students learn about the brain. And so this includes creating presentations like this one and database resources and workshops, things like that. So we're really excited to bring this workshop to you all, and thank you all for attending. And I'll hand it over to our wonderful team, starting with Krish.
So hey everyone, my name is Krish Shaw. I am a rising senior in high school, currently living in the state of Massachusetts in the United States. And a fun fact about me is that I like to draw in my free time. So this is the presentation that myself and our entire team have created for you, our Synaptic Hacks Neuroscience Crash Course. Can we move on to the next slide, please? All right, so this is the introduction. So essentially, we'll be giving you the fundamentals of how the nervous system operates, the various components of it, the various organs associated with it, and their functions as well. So starting off, the nervous system, it is comprised of two major parts, the central nervous system, abbreviated as CNS, and the peripheral nervous system, abbreviated as PNS. So the CNS includes the brain, which is your body's control center, and your spinal cord. I like to think of the spinal cord as a highway of communication that relays messages between your various sensory organs and your brain, but we'll get to more detail on that later in the presentation. The CNS has various centers located within it that carry out the sensory, motor, and integration of data. Sensory often refers to your various senses, your five senses. Motor means your movement, and integration of data can mean various different definitions, such as your emotions, feelings, and thoughts. These centers can be subdivided into two main portions, which are your lower centers, including the spinal cord and brainstem, and your higher centers, which are communicating with the brain via effectors or organs or cells that act in response to a stimulus. So effector can be something as simple as a muscle contracting your arm to make it flex, for example, or your muscle releasing saliva from your salivary gland. These two systems function together by way of nerves communicating with each other by action potentials from the PNS entering and becoming part of the CNS and vice versa. So continuing on, the PNS, or the peripheral nervous system, the second main portion of the nervous system, is a vast network of spinal and cranial nerves. Cranial nerves are basically nerves on your face that are linked to the brain and spinal cord. It contains sensory receptors, which help in processing changes in the internal, meaning your inside of your body, and external, meaning outside of your body environment. This information is sent to the CNS via afferent sensory nerves, which we will get into more detail later on in the presentation. The PNS is then subdivided into two major portions. So first we have the autonomic nervous system, which includes involuntary controlled internal organs, such as your lungs and your heart, blood vessels, and then smooth and cardiac muscles. So essentially the autonomic nervous system has to do with unconscious movement of your internal organs, meaning you don't think about using these organs ever in your life. And then somatic nervous system, the second major portion of the PNS, is involving voluntary control of your skin, bones, joints, and skeletal muscles. So this can be as simple as thinking about running, meaning thinking about moving your legs, for example, and the various muscles associated with it, meaning it has to do with conscious control. So let's get into more detail with the central nervous system, or the CNS. So the CNS, like I said earlier, plays a central role in your bodily functions. More specifically, your thoughts, your movements, emotions, desires, essentially everything to do with thinking that goes on in your brain, anything that doesn't do with movement really. Your brain is protected by a skull or your cranium, and your spinal cord, the second major portion of the CNS, is protected by the vertebrae or your backbone and travels from the brain to the lumbar region located in the lower back area, as you can see on the diagram on the left. Now, there's one other major portion of protection that the CNS has, which is called a syrinx, a fluid-filled space below the bones that can offer shock absorbance. However, there is a major con to this form of protection, in which if you sustain an injury to either your cranium, meaning your skull, or your vertebrae, this can cause major swelling, because the space between the bones and your internal organs, which is encompassed by the syrinx, is very tight, and therefore there isn't much space for the syrinx to move around. Therefore, if you sustain an injury, that can cause major swelling, leading to major complications, and that is why it is often recommended to get treatment as soon as possible if you sustain injuries to these areas. Now, just simplifying things a bit further here. So like we covered already, the brain and the spinal cord are the two major components of the central nervous system. Like I said earlier, the brain is really our center for thoughts, interpreting external stimuli or conditions factors, and controlling your body movement or your motor functions. While your spinal cord, like I mentioned earlier, is that highway of communication, and it contains reflex arcs or neural pathways that control reflex. And then both the brain and the spinal cord have something called gray and white matter. So white matter has to do with wiring and cushioning, like we like to call it. This is essentially coordinating communication or your nerve signals between different parts of your brain, which are called action potentials, which we will also get into more detail later on in the slideshow. And then the gray matter really processes sensory and motor information, meaning information that your five senses detect, and just your overall movement. Okay, let's get onto the PNS, or your peripheral nervous system. So the peripheral nervous system regulates your internal movements, meaning inside of your body. This can include sensory nerves and sense organs, which monitor internal and external conditions and send this to the CNS for an appropriate response. Your nerves and ganglia are the most important parts. So nerves are basically like telephone wires. They're like bundles of fibers that connect the brain to the rest of the body's parts and allow the brain and the rest of your body parts to communicate with each other, basically allowing you to live a healthy, sustainable life, as well as just allowing you to move and conduct very fundamental body functions as well. Your ganglia are small knots of these nerve cells, like I described earlier, located outside the CNS, and really are sort of like middlemen, allowing the CNS to communicate with the PNS. Your PNS neurons transmit information to the CNS, and this information is processed and travels back the other way, meaning your CNS is conducting a response to the signal that is received from the PNS. This is conducted through two different ways, including afferent, which is through sensory neurons. This allows us to use the sensory information that we receive and send it to various parts of the brain and spinal cord. And then efferent is through motor neurons, which are transmits impulses from the CNS to peripheral organs, essentially when an action is occurring. Now, the efferent system is split into two other portions, such as the somatic nervous system and autonomic nervous system. So like I covered this earlier, the somatic nervous system has to do with conscious control, and it supplies motor impulses to the various skeletal muscles, like I said, conscious control. And then autonomic nervous system is unconscious or involuntary control, and it supplies motor impulses to the various muscles. So this is a diagram really simplifying it out. Like we covered earlier in the presentation, your CNS being consisted of the brain and spinal cord, your PNS consisting of the somatic and autonomic nervous system. And then the autonomic nervous system, we haven't really covered this in the slideshow yet, but it consists of two other parts, the sympathetic and the parasympathetic nervous system. The sympathetic nervous system really arouses the body to expend energy, and then the parasympathetic nervous system calms the body to conserve and maintain energy. But again, this is more of the specifics of that the autonomic nervous system, so we really haven't covered that yet. So does anyone have any questions that I might be able to answer, or my team? All right, seeing none, I guess we'll just move on to the next part. So next part of the presentation is really the parts of the brain, meaning your organs and their various functions. So three main parts of the brain. There's three major portions: the cerebrum, the cerebellum, and the brainstem. So starting off with the cerebrum, it encompasses the most space in your brain. It is responsible for remembering, problem solving, otherwise known as critical thinking and feeling. It also controls your movement, involuntary and voluntary. Next, we have the cerebellum, which is mainly responsible for coordination and movement. This doesn't just mean coordination between, like, for example, activities such as walking, running. It's really coordination between how your body conducts various processes, such as the blood flow from your heart to the rest of the body's organs, or respirating and breathing in and breathing out. It also has to do with balance, and it plays a critical role in cognitive functions, meaning understanding and comprehending a language and attention. The next part of the brain is the brainstem, and it controls involuntary actions such as breathing, digestion, heart rate, and blood pressure, meaning actions that you don't necessarily think about that are being conducted inside of your body on a daily basis. All right, so the next part is more specific structures. So the thalamus is located deep inside that cerebral cortex. It's responsible for processing information to and from the spinal cord and cerebrum. It's also from the various sensory organs, and it's responsible mainly for managing your sleep cycles, consciousness, and alertness. So the pathway in which this occurs is the sensory impulse reaches the thalamus, which reaches the cerebral cortex that interprets the signal, such as a touch, pain, or temperature, and then your brain elicits the appropriate response. The hypothalamus, the second region, it has three regions inside of it: the anterior, the middle, and posterior. There's three main portions because each contains a cluster of neurons, meaning a specific function. So starting off, the anterior is responsible for secreting the various hormones in your body. The middle portion of the hypothalamus is responsible for controlling your hunger and appetite. And then the posterior is responsible for regulating body temperature or homeostasis. Some other functions that I haven't touched upon really of the hypothalamus are maintaining daily physiological cycles, managing of sexual behavior, and regulating emotional responses and sleep cycles. Finally, some more specific structures include the pons, which is the largest part of the brainstem. The brainstem connects your brain to the spinal cord and is probably one of the most important regions of your brain. The pons is a group of nerves that connects different parts of the brain. Like I said earlier, it also connects your brain to the spinal cord, and it also contains the beginning of some cranial nerves, or the nerves on your face, such as the ones responsible for facial movements and relaying sensory information. Then we have the medulla, which is located at the base of the brain, where the brainstem connects the brain to the spinal cord. So like I said earlier, the brainstem is the region where the brain connects to the spinal cord, but the medulla is that specific portion. It's important because it passes messages between the brain and spinal cord, and it also plays an important role in the cardiovascular, meaning having to do with your heart, and respiratory, meaning having to do with your lungs systems, and it controls your autonomic activity, meaning unconscious activity. So I'll turn over things to my colleague here, Brittany, who will talk about more specific structures and regions of the brain.
Hello, everybody. So my name is Brittany Alexander. I'm currently in university doing biomedical science. So thank you, Chris, and I will take it from here. So the more specific sector is the pituitary gland. This is a part of your endocrine system, and it is a tiny bean-like structure positioned just behind the nose bridge. It's a hub gland that regulates the body's other glands and their hormones, and they flow based off signals from the nearby hypothalamus. It actually works through a portal system, which is kind of cool. Additionally, this houses a variety of hormones of its own, which are also released based on hypothalamus signals from the anterior pituitary. Okay, so now we have the lobes of the brain. So basically, you have the frontal lobe, and this is going to manage your personality traits, your problem-solving abilities, your emotions, basically everything that makes you, you. And it also is involved in things like smell recognition and things like contains focus areas, so speech, things like that. Then you have your parietal lobe, and this is deals with visual spatial processing. So in other words, it's where that person is located relative to other objects. And it kind of tells you where you are in space. So we call this proprioception. It also has to do with object classification. The parietal lobe also interprets touch, and that's the pain experienced by any other area of the body. And it contains Wernicke's area, which, like Broca's area, is involved with language, but this area specifically helps you interpret oral language. So you have the occipital lobe, which is associated with visual processing and general vision. So basically, kind of allows you to understand what you're looking at. It also is associated with distance and depth perception, so allowing you to see how high up you are compared to the ground. Color determination, object and face recognition, and memory formation. So we also have the temporal lobe, which oversees the abilities such as musical rhythm, short-term memory, hearing, speech, and facial recognition. It also helps if you understand language, retain visual memories, and processes and remembers emotions. So again, the temporal lobe kind of is a place where everything is combined. And so we're going to let Aaron here and you ask you a little game.
Yeah, so this is a cool puzzle game. So basically, it's just, I'll send the link in chat, and it's just a fun card matching game where you flip them over and try to match them with each other with the content that we've learned so far. And it's really fun, and it's just a supplement to these slides. So I will send the link in chat. Right now, there you go. Right, and moving on. Yeah, so does anyone have any questions about what we've learned so far before we move on to new content? No, the information can get pretty dense, so it's perfectly makes sense if you do have a question or two. But if not right now, and you're still processing a little bit, just feel free to put it in chat, and we have a whole team here waiting to answer any questions you have. So let's move on with Brittany.
Okay, so another activity for you all is to put a Kahoot here.
All right, so it is Kahoot time now, our favorite time of the day. So let's get that started. All right, 1 second. All right, here we go. We'll go classic. All right, so this will be about everything that we've learned so far. Join if you'd like. We'd love if you joined us. And it should be fun. Team members, if you'd like to join and play along, feel free. And you can use your name preferably, but A works as well. Just no inappropriate nicknames, please. And just another reminder, if you have any questions, feel free to continue to put those in chat. Just wait for everyone to put in their code. I hope you all are enjoying the presentation today. We have a lot of content to cover. And we've got a question in chat. So presenters, if you could take that, that'd be awesome while we get moving with the Kahoot.
So that is actually a great question, Natalia. So there is overlap between the nervous system, which will control your body and all of its functions. So the pituitary particular.
Hey, Brittany, not to interrupt, you're cutting out a bit for me. I don't know if that's just my Wi-Fi or something, but if it's, you seem to be cutting out.
It is directly connected, so it takes signals from the hypothalamus.
Uh-oh.
Oh, okay. I can hear that.
Yeah, would you mind answering in chat?
Yeah, for sure I can do that.
Sorry, yeah, thank you. All right, just maybe as many of you as possible. I'm not sure how many of you would like to play, but please join us. It'll be really fun. It's a pretty short one because we do want to move on to the rest of the presentation, so it hopefully won't be too much pressure for you all. It should be really fun. We'll wait until maybe 1 or 2 more people join, and then we'll get moving. Cool, 2 more people join, awesome. I'll wait like 1 more minute just in case you both came in like at the same time, so I don't know if people are still. Cool, yeah, we did have more people, awesome. Yeah, I'll give it like 1 more minute. Don't want to wait too long. Yeah, I hope you all are enjoying the presentation. We have a lot of content, more activities for you all. About memories is the next part, a little spoiler. A little sneak peek into the next section. It's all about memories. All right, I think we can go ahead and get started. So here we go. So it's all about brain anatomy. Let's see what you all learned. So what month is it? Let's see. So some of these aren't directly related to what, it's not a trick question, by the way. It's not directly related to what you all learned, but it does have a purpose. So just answer the best that you can and the best that your memory allows. July, it is July. Awesome job. All right, next question. Bit of a case study for you. You got this. You can do it. 1 second left. Awesome. Yeah, so the cerebellum is directly related with coordination, movement, balance. It's sometimes called, the mini brain. It has a lot of cognitive functions as well. So it's a really cool structure if you ever want to read up on it. All right, next question. All right, another example question for you. A little bit of a trickster here. You can do it. Wow, y'all answered quickly on this one. Good job. Yes, so both the hypothalamus, 100% of you got it right. Awesome. Yeah, both the hypothalamus and the pituitary gland are involved in the endocrine system and releasing hormones. So great job, everyone. And they do have other functions, but for the sake of that question. All right, true, false. Damage to the parietal lobe will not cause visual difficulties. True or false? Oh, split. Halfway. Yeah, they have some functional overlap. All right, next question. Right. Phineas Gage reports having extreme behavioral changes after a work accident. Which brain structure was mainly affected? So which brain structure controls a lot of your personality, how you behave, of your higher cognitive thinking that might influence quite a lot? Yes, the majority of you got it. Awesome job. Yeah, the frontal lobe is the lobe that deals with all of those things. We got some healthy competition going. Awesome. Next question. Damage to which part of the brain is most likely to result in out of control breathing and tachycardia? Pretty sure. High heart rate? You all can do it. A lot of autonomic nervous system function with this structure, if that's any help. Yes, most of you got it. Awesome job. Yeah, so with this one, the brainstem is the one with the medulla and the pons. That's going to be the one that's controlling a lot of those autonomic nervous system functions like breathing and heart rate, the things that you don't really think about, but they're in your subconscious or in your unconscious. And so when I'm talking right now, like think about your breathing, it's now brought into your conscious mind and you're thinking about your breathing. But most of the time, it's still controlled by your autonomic nervous system, and it's an unconscious behavior. Great, nice. Wow. Completely new top 5. The cerebellum plays 0 role in cognitive functioning. True or false? You got this. A lot of quick answers, quick fingers. Awesome. Yes, the majority of you got it right. Awesome. And for those of you that are getting some of these wrong, that's completely okay. Do not worry about it. It's all part of the learning process. So CIPA is a rare neurodegenerative disease that causes patients to be unable to feel pain. This is due to loss of blank. Sensory neurons, motor neurons. What do we think? Let's see. Yes, 100%. Amazing. Y'all are learning. All right. The thalamus plays a large role in sensory interpretation. True or false? Getting into the more recent content here. Yes, true. Awesome job. All right, question 10. Out of 11, so home stretch. Finish strong. A patient reports having difficulties with language, facial recognition, and hearing. Which region is likely involved? This one's slightly harder, but we did cover it. You can do it. Yeah, so most of you got it right, but that one was a bit harder. So good job to you, 8. And for the 7, that completely makes sense. It does, so don't worry about it. Yeah, so that'll be the temporal lobe that deals with those things. All right, last question. You can do it. So which lobes play a role in memory formation and storage? Or lobe? Let's see, finish strong. Very mixed. Yep, but it's all of them. So 100% correct. Yeah, memory is very really important in the brain, and so there's a lot of networks that are related to it throughout the entire brain, and it's so important that it is going to be our next topic. So stay tuned. But for now, let's see our winners. Tala, awesome. 9 of 11. That's really good. Krish, yes, good job, good job. All right. Our first place, A. Awesome job. We love to see it. And to our runner-ups as well. Awesome job, everyone. And now we will head on over back to our presentation. I'll exit out of the Kahoot and I can still hear it. All right. Amazing job. So now we will continue our presentation with the neuroscience of memory with Brittany. All right.
Hello, everybody.
Brittany, just to let you know, you are still cutting out a bit. Is there an area in your location where you can go for a bit better of a connection?
Hopefully you'll have fun with the Q&A. But now we're going to talk about the memory. So psychologists and neuroscientists, I'll try and clear as possible. So basically the two categories are declarative memory, which has a conscious component. And this is basically facts and events that you can speak out. Basically, whenever you write an exam, you're testing your declarative memory. And then you have your non-declarative memory, which includes the type of memory systems that do not have a conscious component. So you're not able to necessarily speak them back out. Something like riding a bike would be non-declarative memory. So they are very important as well. So again, continuing with non-declarative memory. So again, things like riding a bike, playing an instrument, memories for skills and habits, things you don't have to think about every day. So we have a phenomenon called priming, in which exposure to one stimulus influences how a person responds to a subsequent related stimulus. stimuli often conceptually related words or images. So kind of to explain this, um, basically everything is kind of connected in our brain, and you're able to make links between stimuli. So, for example, exposing someone to the word yellow will evoke a faster response to the word banana than it would to an unrelated word like television. Because yellow and banana are more closely linked in memory, so people will respond faster to the second word than they will the first. And this is a really interesting concept because you'll see this a lot in, for instance, when you are writing text or something like that, where the word you can help in kind of recalling certain memories and certain memory systems, so better allow you to answer things and recall things faster. So there are simple forms of associative learning, and this is basically what we call classical conditioning or Pavlovian conditioning. So basically, pairing one stimulus with another and later testing or not there has been a one connection between the two stimuli. So what's happening is that one stimulus is being paired with another, and this is called an unconditioned response, and the stimulus is called a conditioned stimulus because this stimulus now is conditioned to elicit that response. So for instance, Pavlov did some experiments where he would ring a bell and present dogs with food. Eventually, the dogs ended up recognizing the bell as a sign for food alone, and they just started salivating whenever he rang the bell, even when food wasn't presented, because they had learned an association between them. So other parts of learning basically include habituation and sensitization. Habituation is basically what we mean when we say we got used to something. Basically, it occurs when we learn not to respond to a stimulus that is presented repeatedly without change, punishment, or reward. So, for instance, if you are listening to music and not paying attention to it, eventually your brain will stop sending as strong signals about it. So if the TV plays in the background while you're studying, you might recognize it more at first, but eventually it kind of drowns out. And then there's sensitization, which goes against habituation. So basically this occurs when a reaction to a stimulus causes an increased reaction to a second stimulus, an exaggerated kind of startle response. So a loud sound being suddenly heard may startle you, and the more and more that you hear the sound, though, your reaction is still going to be the same, if not stronger. So these are basic kind of responses, and you'll be able to see these happening in everyday life. But yeah, so habituation is getting used to it. Sensitization is kind of the opposite. So basically going again, talking about declarative versus non-declarative memory. Declarative memory is knowing what, and again, being able to speak something out loud, like a fact or an event. And non-declarative memory is knowing how. Again, kind of like how to ride a bike, how to do basic kind of tasks. So we like to think that memory is similar to taking a photograph and placing it into a filing cabinet to be recalled, and that is slightly accurate, but also not. Because the more we recall memories, the more distorted they actually become. Not for facts and stuff, but more for memories of events. So yeah, memory is more like taking a picture and tearing it up into small pieces and putting the pieces in different ways. So the memory is then recalled by reconstructing the memory from all the individual fragments. So the globalization of memory, as we said earlier, all parts of the brain kind of contribute to memory. And many scientists have argued that it's located in specific parts of the brain, that specific neurons can be recognized for their involvement in forming memory. Things like neurons in the amygdala that have been known to contribute to memories that involve fear and pain. And the hippocampus is responsible for all kinds of things with memory, also with learning and long-term memory. So each single brain area kind of contributes.
Hey, Brittany, can you hear me?
Yes.
So we're getting some DMs that your mic is cutting out a bit. Would it be possible to go to an area where you might have better Wi-Fi, or your audio is just cutting out quite a bit?
Here, I can try this. 1 second.
Cool. Yeah, and if not, we can have someone else take over. It's okay. But we'd love to still have you present. But yeah, in the meantime, does anyone have any questions? You can show them in chat.
Involvement in forming memories. And again, this includes like specific neurons in the amygdala that are known to contribute to memories involving pain and fear. So again, talking about the amygdala, it regulates emotions such as fear and stress, and it's connected to memory in terms of influencing it with stress hormones. So responsible for memory consolidation and the process of turning a new memory into long-term memory, making sure that you don't repeat the same thing that caused you that fear or pain or other things. So one researcher experimented with rats and their fear response and found that using Pavlovian conditioning, a neutral tone was paired with a foot shock to the rats. So basically they would play this tone and then shock the rats. So fear memory was produced in the rats, and each time they heard the tone, they froze, a sign of a defense response, meaning that they indicated a memory for the impending shock when the tone was presented alone. So the hippocampus is also part of memory, and it actually is involved in a lot of consolidation and turning things from short to long-term memory. So it's used in normal recognition and spatial memory, protects info in the cortical regions that gives memories meaning and connects them with other memories. It also plays a role, again, in consolidating memories. So injury to the hippocampus leaves us unable to process new declarative memories. So basically, kind of an amnesia where you can remember the past, but you can't remember present events, like new events. So one famous patient was HM, who had both his left and right temporal lobes, so the hippocampal region removed, to help control seizures he had been suffering from for years. But after it was removed, his declarative memory was significantly affected. He was able to form new memories. His ability to form new memories was lost, but he could still remember memories that had occurred prior to the surgery. So again, another part is the cerebellum, and how this is involved in memory is kind of being able to create implicit memories. So the hippocampus processes explicit memories, and you can still lose them, and be able to create implicit memories. So for basically procedural memories, motor learning, classical conditions, associations, all kinds of things. So a classical conditioning experiment is to accustom subjects to blink when they are given a puff of air. This is normally done with rabbits. So cerebellum of rabbits was damaged by researchers, and the rabbits were not able to learn the conditioned eye blink response. So again, basically what this experiment normally does is they'll do a puff of air to the eye and the rabbits will blink. And you can pair this puff of air with a sound or another stimulus and train the rabbits to blink in response to that stimulus, unless you remove this area of the brain. So for the prefrontal cortex, using PET scans and other kinds of brain scans, they were able to see that it is involved with memory. It was shown that the prefrontal cortex is greatly needed to perform semantic tasks, so like characterizing a noun of whether it is a living or non-living thing. So in this study, participants had to complete 2 tasks, perceptual and semantic tasks. So when asked which words they had previously seen, recall was much better for semantic tasks than for perceptual tasks. Perceptual tasks. PET scans showed more activation in the left anterior prefrontal cortex for the semantic task. So again, showcasing the involvement of the prefrontal cortex in memory. So a fun topic here is neurotransmitters. These are specific chemicals that the brain releases in order to send signals from one neuron to another. So they're involved with the process of memory. Some specific ones are epinephrine, dopamine, serotonin, glutamate, and acetylcholine. You've probably actually heard all of these words before, at least some of them. So researchers in neurotransmitters are still discussing, debating as to which neurotransmitter plays a specific role, because again, multiple probably overlap. So communication among neurons through neurotransmitters is critical for developing new memories. So memory consolidation occurs through repeated activity by neurons, which leads to increased neurotransmitters in the synapse and more efficient and more synaptic connections. And basically, this is kind of what we call plasticity.
Hey, Brittany, can you hear me? Brittany? Can you hear me? Okay, if not, I'll just move on.
Okay, so we're going to go for one last slide here, and then my colleague's going to take over. But arousal theory basically states that strong emotions are proven to trigger the formation of strong memories. So if you were really, really scared, you'll probably remember that more. And if you were really, really happy, you'll probably remember that more than just if you were a tiny bit frightened or a tiny bit happy. And that weaker emotional experiences will form weaker emotional responses in return. So strong emotional experiences release more neurotransmitters and hormones to strengthen the memory, and their memories for emotional events is much better than a memory of a non-emotional event. So if a certain word or whatnot was paired with a strong emotional memory, you'll have a better time remembering that word or the meaning of that word. So when humans and animals are stressed, the brain secretes more of the neurotransmitter glutamate. Glutamate helps to bring neurons closer to stimulation and thus makes it more easier to activate them. So this helps to remember stressful events. We call this the flashbulb memory phenomenon. So flashbulb memory is an exceptionally clear recollection of an important event.
Awesome. All right, Brittany, can you hear me now? I suppose not. I was just going to address the question in chat of, is the blinking response mentioned here similar to reflex actions? And my answer to that is yes. We can go back to that slide real quick if I can. Was it this slide? Either way, it should be, because it's similar to, like, if you put your hand on a hot stove and then you draw it away really quickly, that's your spinal cord reflex, and you don't even realize that you're pulling your hand away because your brain or your spinal cord recognizes that and then connects it to the brain, and then it brings into your conscious, oh, I need to pull my hand away. But but your spinal cord reflexes, recognize that first. And so yeah, the blinking response should be similar to that, to answer your question. But yeah, now I hope but you all can hear me, right? If Brittany couldn't hear me. Oh, Brittany, okay. Yeah, she put in chat. Okay. Awesome. All right, Brittany, we have another question in chat of what are implicit and explicit memories? If you could answer that in chat, that would be amazing. So then we can move on with Tanvi with the rest of our presentation, or the next part.
Hello, everyone. I'm Tanvi and I'm from India. One fun fact about me is that I love going on nature treks. And I'm very excited to be here today. So let's start. Now, we have types of memories, that is short-term memory and long-term memory. Now, what exactly is short-term memory? Short-term memory is the capacity for holding a small amount of information in mind in an active, readily available state for a short period of time. For example, short-term memory can be used to remember a phone number that has just been recited. Now, what does short-term memory do? It stores information for a brief period of time for things that happened recently, and it acts as a scratchpad for temporary recall of information being processed and decays rapidly and has a limited capacity. Now, two ways to make information more likely to be held in short-term memory is: one, rehearsal, saying or doing something to oneself over and over again, essentially repeating it. Two is chunking, organization of material into shorter, meaningful groups to make them more manageable. Now, I'm sure all of us would remember a hyphenated phone number rather than a long, non-hyphenated one. Now, the next type of memory is long-term memory. Long-term memory is used for the storage of information over long periods of time, ranging from a few hours to a lifetime. It is divided into two parts. One is explicit memory and two is implicit memory. Now, Aniket, coming back to your question, explicit memory is a type of long-term memory, also known as conscious or declarative memory, and it involves memory of facts, concepts, and events that require conscious recall of the information. This type of information is explicitly stored and retrieved, hence the name explicit memory. Now, the long-term memory, explicit memory, is further subdivided into semantic memory and episodic memory. Semantic memory is focused on general knowledge about the world and includes facts, concepts, and ideas. Whereas episodic memory, on the other hand, it involves the recollection of particular life experiences. For example, Albany is the capital of New York is semantic memory. But the first time you travel by plane, that is stored in your episodic memory. Unlike explicit memory, implicit memory involves procedures for completing actions. But what is implicit memory? Things that people don't purposely try to remember are stored in the implicit memory. This kind of memory is both unconscious and unintentional. Implicit memory is also sometimes referred to as non-declarative memory, since you're not able to consciously bring it into awareness. For example, athletic skills are one example of implicit memory. You learn the fundamentals of a sport, practice it over and over, and then they flow naturally during a game. Now here is a short flow sheet. Memory is divided into short-term and long-term. Long-term is further divided into explicit, which is conscious, and implicit, which is unconscious. Explicit is divided into episodic and semantic, whereas implicit is divided into priming and procedural. Now, coming to memory loss. What exactly is memory loss? It is the inability to remember events for a period of time, often due to brain injury, illness, or the effects of drugs or alcohol. The first effect of aging is a number of conditions can cause memory loss, so it is important to get a prompt diagnosis and take appropriate care of oneself. Normal age-related memory loss doesn't prevent you from living a full productive life. The signs of memory loss are: you may occasionally forget a person's name but recall it later in the day, or you may need to make lists more often than in the past to remember appointments or tasks. These changes are generally manageable, They don't disrupt your ability to work or live independently. The next factor is dementia. Dementia is the impairment in memory, reasoning, judgment, language, and other thinking skills. Dementia usually begins gradually and it worsens over time. It impairs a person's ability in work, social interactions, and relationships. It mainly affects older people. However, it is not a normal part of the aging process. Some symptoms are asking the same questions repeatedly, taking longer to complete familiar tasks, such as following a recipe, getting lost while walking or driving in a familiar area, or having changes in mood or behavior for no apparent reason. The third factor is Alzheimer's disease. Alzheimer's is a degenerative disease that is caused by complex brain changes following cell damage. It leads to dementia, symptoms that gradually worsen over time. Most common early symptoms are trouble remembering new information because the diseases typically impacts the part of brain associated with learning. As it advances, symptoms could get more severe and include disorientation, confusion, and behavioral changes. Eventually, speaking, swallowing, and walking become difficult. At the moment, there is no way to prevent, cure, or even slow down Alzheimer's disease. Important. Dementia is a general term for the decline in mental ability, severe enough to interfere with daily life. Alzheimer's is the most common cause of dementia. It is a specific disease, whereas dementia is not a specific disease. Now here we have a diagram showing the progression of Alzheimer's disease. In this disease, as neurons are injured and die throughout the brain, connections between networks of neurons may break down and many brain regions begin to shrink, as we can see in mild Alzheimer's disease and severe Alzheimer's disease. By the final stages of Alzheimer's, this process called brain atrophy is widespread, causing significant loss of brain volume. The fourth cause is due to emotional. Because our mind and body are connected and affect each other, our emotions and thoughts can impact our brain. Here are 3 examples. First being stress. Too much stress can overload our minds and cause distraction and brain drain. Short term can trigger a momentary memory problem, whereas long term may increase your risk of dementia. Second, depression. Your mind and emotions may be so weighed down that you are not able to pay much attention to what's happening. Recalling something that you weren't paying attention to is difficult. Pseudodementia describes the combination of memory loss and depression. Third, anxiety. Generalized anxiety disorder can continually interfere with healthy functioning, including memory. When constantly anxious and nervous, it is hard to stay focused and so memory is diminished. The fifth cause is due to low vitamin B12. Vitamin B12 is regarded as an essential nutrient for a reason. If someone has a deficiency in vitamin B12, the symptoms can be mistaken for dementia. Why? Because vitamin B12 has the property of maintaining healthy nerve cells and red blood cells. When there isn't enough vitamin B12 in our system, our nerve cells will suffer, causing dementia-like symptoms. On the bright side, after receiving adequate vitamin B12 consumptions, those symptoms may improve and even resolve for some people. So make sure you take those vitamins. The sixth cause is due to a stroke. Strokes can significantly affect our brain functioning. Sometimes the memory loss related to a stroke is permanent, but other times the cognitive functioning improves as the brain recovers. Now, what is a stroke? It is a medical emergency where there is damage done to the brain due to tissue death caused by an interruption of the brain's blood supply. For example, a clot in a blood vessel that leads to the brain can cause a stroke. The last cause is due to brain tumors. What are brain tumors? A brain tumor is a mass or growth of abnormal cells in our brain. Some of them can be really bad, that is malignant cancerous tumors, or they may be non-cancerous, that is benign. The tumors that form in the brain can often impinge on certain parts of the brain, causing extreme signs and symptoms that affect the patient. How do they affect memory? They can cause headaches and physical problems, can affect memory and personality at times. Depending on the severity and type of tumor, treatment can often relieve these symptoms. For example, people with brain tumors may not remember their family members because the tumor is impinging on a part of the brain. So does anyone have any questions that I can answer?
Yeah, thank you so much. That was an amazing presentation. And we do have one question in chat. I put some stuff about it, but maybe you could speak more to it. But the question is, how do you define memory loss due to old age? And they said, since I may forget something and recall it later on. So like, it might be a pun, but yeah. So can you speak to how do you define memory loss due to old age?
Yes, as we grow old, our neurons are injured and they die throughout the brain. And that is why the connection between networks of neurons may break down. This is why when we grow old, we start losing our memory.
Awesome. Okay. And now it is time for the next portion of our presentation. This was on a previous slide, we sent the link in chat. So hopefully, hopefully you all received that. And feel free to work on that after the presentation or during it if you'd like as well. So moving on to the next part of our presentation.
Hello, everyone. My name is Prakriti Kadekar. Fun fact about me, I am a Taekwondo athlete and I'm a rising senior in high school from New Jersey. So here I am here to present to you the biological basis of neurological conditions. I'll be going over 5 of these, 2 of which were elaborated by my colleague Tanvi in the previous portion of the presentation. And with that, let's get started. Okay, so the first one I'll be talking about is Alzheimer's disease. So you can see on the picture right here, on the left-hand side of your of the image is a picture of the healthy brain. If you can see the cerebral cortex, which is responsible for language and information processing, and the hippocampus, which is critical to the formation of new memories, those 2 areas specifically do get affected by Alzheimer's. The cortex shrinks over time, and that damages areas in thinking, planning, and remembering. The ventricles are filled up with something called cerebrospinal fluid, which grows larger and expands, and the hippocampus shrinks severely. So Alzheimer's disease, or AD, which I'll be referring to, is an irreversible progressive neurodegenerative disorder that causes the brain to undergo atrophy, which is the shrinkage and death of brain cells. 1 in 9 people above the age of 65 suffer from AD, and that's the most common disease in people of that certain age bracket. So here are some early signs that Alzheimer's patients could have early on. They could have memory loss, misplacing belongings, hard to complete familiar tasks such as turning on the TV, confusion of time and place, communication problems, and social withdrawal. So the exact causes of Alzheimer's in of itself is not completely understood, but many researchers are saying this can be due to lifestyle, genetic, and environmental factors. The cognitive, emotional, and behavioral abilities worsen as the disease progresses. As mentioned before, the cerebral cortex is initially affected with this disease as there's a decrease in brain tissue and a decrease in size. And the atrophy starts in this cortex of the temporal lobes, which are responsible for your memory and cognitive functions, and that later affects the other lobes of the cerebrum as well. Okay, and the next one I'll be talking about is stroke. So there are two terms that you have to know. One is called hemorrhagic stroke, which is basically the bursting of a blood vessel. And the other one is the ischemic stroke, which is the blocking of the blood vessel. So stroke is basically a vascular injury in the nervous system that could result in ischemic strokes, in which there will be a clot in the artery, which happens 85% of the time, the intercerebral hemorrhage or bleeding in the brain, which can happen 10% of the time, and the subarachnoid hemorrhage, which is the bleeding around the brain, which happens 5% of the time. In the United Kingdom alone, there's 150,000 strokes that happen annually, and 20% of those are fatal, and less than 20% of the surviving patients fully recover. So when a stroke happens, the middle cerebral artery gets clogged because it is a narrow continuation from something called the internal carotid artery. And blocking this part of the region has widespread effects. It basically affects all the regions that you can see in red in the diagram to your left. The hemorrhagic strokes are typically occurred by something called an aneurysm on weakened blood vessels or on the intravenous malformations, which are basically clusters of abnormal blood vessels in your brain. So in the first few minutes of the stroke, there's something called the near crisis, which is basically the death of body tissue in which something called the infarct core forms. So there's a certain part of your brain that the stroke would target, which is known as the penumbra, which is basically highlighted in blue in the first two diagrams that you can see. This infarct core basically spreads, leading to apoptosis, which is cell death, inflammation and scar formation, and that leads to a brain cavity in which there's a loss of neurons and therefore a loss of function in that specific region. Next one I'll be talking about is multiple sclerosis or MS. Okay, so MS is basically a slow progressive regional damage and destruction of the myelin sheath. So on the picture on the right, on the left-hand side, you can see a healthy neuron that's basically having the myelin sheath covering up the fiber of that neuron. On the right-hand side, you can see that nerve is affected by the MS. So the fiber is exposed, and that's due to the damaged myelin sheath that covers that fiber. So this can cause the damage of the fibers themselves, and there will be asynchronous firing of the neurons. And this is an autoimmune condition, which means the body would basically attack healthy tissues as though they were foreigners to the body. And there tends to be remissions and exacerbations of the symptoms. So in MS, there are islands of demyelination and loss of agliodendrocytes throughout the CNS, and that's mostly observed in white matter. So basically, white matter is that region between your brain and the spinal cord, and that houses all your nerves. And this includes the optic tracts, and hence that contributes to a loss of vision. And other areas commonly affected include spinal cord, brainstem, cerebellum, and the cerebral cortex. Symptoms of MS can include dizziness, balance difficulties, blurry vision, numbness or weakness in the body, and muscle spasms. Next one I'll be talking about is anxiety. So basically, anxiety is a normal reaction to stress. It's like you're going up to present something in front of a class, your hands get sweaty, your heartbeat pounds. That is a normal reaction to stress. What causes the disorder, though, however, is when the anxiety keeps on recurring for long periods of time. So the causes of anxiety are biologically unknown, but they can be attributed to genetics, brain biology and chemistry, stress levels, and environmental influences. You are more prone to gain anxiety disorder if you have certain personality traits like introvertedness in social situations, and that is mostly applied to social anxiety disorder. Traumatic events in childhood and/or adulthood, family history of anxiety and other related mental disorders, and physical health conditions like thyroid problems or erythema. Symptoms of anxiety disorders include anxious thoughts and beliefs beyond your control that creates a high amount of tension, physical symptoms like pounding or rapid heartbeat, unexplainable aches and pains, dizziness, and shortness of breath. You have trouble concentrating and difficulty falling asleep, and caffeine and other substances can worsen your symptoms. So many researchers and doctors will give you anxiety tests in order to diagnose what type of anxiety there is. A single test cannot diagnose what specific anxiety there is. There is one for generalized anxiety disorder, social anxiety disorder, and one for determining whether you have a certain phobia. This includes a lengthy process of physical examinations, mental health evaluations, and psychological questionnaires, and that may also contribute, your doctor might give you blood or urine tests to find underlying medical conditions that can contribute to that anxiety. Treatments for anxiety disorder include cognitive behavioral therapy, or CBT. Basically, it helps you confront your fears, such as if, for example, if you have a phobia of insects, they'll basically help you, try to get over that. Medicines that you can take to treat anxiety disorders includes antidepressants. Last one I'll be talking about is periventricular leukomalacia, or PVL. So PVL is a form of brain damage that affects the white matter of an infant's brain. The infant would usually be born before the due date, or basically a premature infant. To diagnose, the doctors would use a head MRI and ultrasound, and currently there is no treatment for PVL, but kids undergo various therapies like physical and speech therapy. Premature babies have intraventricular hemorrhage, or bleeding into the ventricles of the brain, are at risk for PVL, and that also relates to the depletion of iron concentrations in the body. When the white matter in the brain is damaged, the cells die, and there are a lot of empty spaces and holes in the brain. And the white matter, as I mentioned before, softens and dies around these lateral ventricles. And this becomes a problem because the pentraventricular white matter sends nerve impulses that control motor function, and this gets affected. So as a result, PVL can cause developmental delays, learning disabilities, visual disturbances, and other disabilities in the infant. So with PVL, many children do develop cerebral palsy, which is a neurological condition that causes motor and movement disabilities. There are 5 types of cerebral palsy: spastic, which is basically caused by damage to the brain's motor cortex and pyramidal tracts; ataxic, which is the least common and is caused by damage to the cerebellum; agitoid, which is caused by damage to the cerebellum and basal ganglia; the hypotonic, which is caused by low muscle tone; and mixed, which basically occurs when symptoms of 2 or more types of cerebral palsy is shown. And the location of movement problems is used to determine what type of cerebral palsy the patient has. So you have monoplegia, which affects one arm or leg; diplegia, which affects 2 limbs. Usually legs are the most common case. Hemiplegia, which affects one entire side of the body; triplegia, which affects 3 limbs; quadriplegia, which affects 4; and double hemiplegia, which affects all 4 limbs, but one side is more affected than the other. So here's our activity. So we're going to present to you 2 patients, and based on the information given about their symptoms, we would like you to diagnose the condition. And I think it's fine if they put their answers in the chat.
Yeah, that would be awesome.
Okay. So the first patient we have here has problems of vision, muscle stiffness and spasms, balance problems, depression, difficulty swallowing food, and lack of coordination. So if you do have an answer, you can put it in the chat. Also, your options are Alzheimer's, stroke, PVL, anxiety, and MS. Okay, a lot of people are saying Alzheimer's. One is saying MS. Okay, I think we can move on to the answer. No one else has the answer. Yeah, so the answer is multiple sclerosis. One of the main symptoms derived from MS is the muscle spasms, which I did mention in the previous slide. Next one, this patient has drooping on one side of the face, speech difficulty, muscle weakening on one side, confusion and dizziness, and the brain scans have previously shown arteriovenous malformations or cluster of the abnormal blood cells. So you can put your answer in the chat. A lot of people are saying stroke. One person said cerebral palsy. Okay, yeah, we can move on to the answer. So yeah, the majority of you got it. It is stroke, more specifically hemorrhagic stroke due to the cluster of abnormal blood cells. And if you have any questions, I'll try my best to answer them. You can put them in the chat.
All right, if there aren't any questions, I say thank you all so much for coming to this presentation. Thank you for all the team members for putting this amazing slideshow together. And so I'm going to put a message in chat to let you all know that these slides will be sent out after on view only. And a little bit of information about the presentation after this one at 1 p.m. Eastern time. But yeah, so that was our presentation from BRC, Brain Resource Creation. Thank you all so much for attending and have an amazing day.